everybody. This is Rachel and Dean at Patient Pro Marketing. And as we are about to launch our PAD Reach and Reach Out program, and it being PAD Awareness Month, we wanted to introduce you guys to a legend in the PAD world, right? So this is Kim McNicholas. She is with the organizer, the creator of PAD Global Association. And I'm going to let her and Dean just kind of teach our team about PAD and the importance of awareness, of bringing awareness and kind of how to help patients. So Dean, if you want to take it away, go ahead.
Perfect. Thanks, Kim. Thanks, Rachel. Hey, Kim, it's so good to see you again.
It was so fun to have you in our weekly virtual meeting with all of our patients. We had quite a few in there, and I'm sure you learned a lot from listening to some of these very well-spoken patients about their experiences.
I did. It was actually absolutely wonderful to hear. I honestly just wanted to be a fly on the wall, but I got dragged into it by you a little bit there, which is great. It actually got me out of my comfort zone. But thank you so much for the opportunity. But yeah, let's jump right in and get started. So, can you tell us a little bit about yourself and this incredible charity that you've built?
So it started when I was just a journalist traveling the world covering an FDA study of a device that a couple of doctors had told me could be a big breakthrough for saving lives, meaning they felt like it could open up 100% blockages in the heart. Well, the first leg of the journey, pun intended, is the legs. And I wasn't necessarily caring as much about the device as I was the entire process of the FDA journey. What is that like for a potentially life and limb saving device to go through the process? So I didn't care what the device was. I was caring about the process. I was caring about the different cases, what patients experienced, what doctors experienced. And as I was on this journey to nearly a dozen countries, more than 30 states, watching hundreds of doctors perform thousands of hours of these procedures, where I had my tiny little camera and I was documenting everything. And the doctors would treat my camera as if it was a live case in a physician educational event. And I was learning everything, every little nuance, every move, every philosophy they were sharing with me on this camera. And I would come back and sit for hours and I would go through this footage. And I was just like a sponge and I learned. I realized through the journey that different doctors, different approaches, different tools equal different outcomes. And I would be in one case with one doctor in one city where they would use a specific tool, they would save the leg, open it right up, and then literally just one hospital over, the same presentation of disease, the patient was being sent for amputation because standard protocols dictate that if you can't stent a particular artery, you don't treat it. And it was through this journey that I realized that patients needed to be empowered with this type of information. And that's how this journey began. It began as the Way to My Heart, which is our initial charity, and it evolved into a DBA, doing business as the Global PAD Association, where I support communities of thousands of patients across the globe.
Wow, that's incredible. And for those who are watching or listening and might be hearing this for the first time, what exactly is peripheral artery disease? And I mean, it sounds technical, but I have a feeling it's more than people realize.
It's poor circulation and mainly the legs. That's the easiest explanation for it. And I say that because in those simple terms, because so many patients get brushed off as, oh, that's poor circulation. It's just part of old age. And you have in your body this human superhighway, right? And there are lanes that travel north and lanes that travel south. This affects the lanes that travel south in your legs. These are the arteries versus the veins. The veins bring the blood back to the heart to gather more oxygen and nutrients and things like that, to then travel along the arteries to be delivered going south to all your organs, your tissue, and all of that jazz. It is a disease that is more prevalent and deadlier than most cancers combined. More prevalent and deadlier than prostate cancer, colon cancer, and breast cancer combined. And the reason I mention those is because for each one of those, there is legislation that guarantees coverage for early testing, but that is not the case for PAD. And that's something that our Society for Vascular Surgery is working heavily along with other societies to try and bring legislation known as the ARC Act into being so that we can get tested early. If you actually get tested early, conservative measures for treatment are all you need for most people to slow progression or even stall progression of this disease, which is the plaque buildup in your legs. PAD is defined by atherosclerosis in your arteries. Atherosclerosis, tough, heavy, calcium buildup in your artery walls. We all get some of that as we age, but some more than others because of certain risk factors. But the obstruction in your arteries ends up limiting blood flow to your toes. And that's why you start feeling numbness and tingling and sometimes the cramps, in your calf. Most patients that have the traditional form of PAD end up with, calf cramps, right? I don't know if you want me to go into what I view as the two different types of PAD. And that's where I kind of break down the symptoms. But you want me to go into those?
Yeah, I think you wanted to ask about symptoms, right? That's great.
Yeah, so I love that explanation, right? So basically clogged pipes. And so let's get practical, like you just mentioned. What are some of the risk factors that people should be looking out for? And you can break that up into those two little factors that you just mentioned too.
There's so many different risk factors for PAD, and it leads to different presentations of disease. The traditional textbook, and still where so many people get diagnosed with PAD, is with smoking, whether it's nicotine or whether it's marijuana. I don't care which one. You burn anything and you breathe it in, it's going straight into your arteries. It literally starts, it prevents the oxygen from being delivered. It causes inflammation in your arteries, and that leads to plaque buildup. So smoking is a big risk factor. Even one cigarette, even a few puffs can have an impact on your arteries, because the moment that toxic material gets into your lungs, that burned material, no matter what it is, it's causing inflammation immediately in your lungs. And for most people who have smoking as a risk factor, you end up seeing it present in the aorta. That's that big jug of blood that's going right down the middle, right, of your abdomen. That breaks off into the iliac arteries. So that is also where we see a lot of plugging up into the CFA, the common femoral artery. I call that the bendy spot artery. It's when you sit, it's your sit bend, or your bend when you sit, right in there. That's where your CFA is. Those really get blocked. Down into your thigh with your SFA, your superficial femoral artery, and your profunda, and into your knee. So really, it's more of an above knee big vessel disease, right? And it takes years and years and years for that to get built up. And usually you start feeling leg cramps in your calf at that point. You may feel some cramping in your buttocks. You might feel some cramping, behind your thigh or in your hip. And a lot of that is typically that upper vessel disease. Also, old age can be a factor with that. We also have people who have blood clotting disorders that may lead to some of that upper vessel disease. Valvular issues, if you have leaky heart valves, if you have AFib, that can lead to blood clotting. That can also plug up those vessels, okay? And that's what I consider kind of the type 1. That's where we see the intermittent claudicants. And what I mean by intermittent claudicants, these are the early stage PAD presenters. And intermittent claudication is I walk, and when I walk, I start to get a leg cramp. When I rest, that leg cramp feels so much better because the blood is restored. Once I stop walking, the blood flows back into the arteries below my feet and populate my feet. The second set of patients, and this to me is the more concerning patient, it's the diabetics and it's the chronic kidney disease patients. Also, some hypercoagulable patients, like the legendary Deion Sanders from the NFL. He's now a coach in college football. He is considered more hypercoagulable, even though he also likely at his age has the atherosclerosis, right, as we all do in our legs and throughout our body. Just again, it's a matter of different presentations. Different people have different presentations of disease, and plaque builds up differently, right? Some more than others. When it comes to diabetes and chronic kidney disease, most of these patients end up with clots below their knees. You have 3 arteries below your knees, right? The popliteal behind your knee breaks off into 3 main arteries that go down there, and they're small and they're fragile, and they get plugged up a lot more easily. And when you have diabetes, you end up with a little bit thicker, stickier blood, right? A lot of clotting that can happen if your A1C is too high. And those get mucked up pretty quickly and pretty easily. And that's what we consider more of a bottoms up disease versus the other, which is more of a top down disease. And this bottoms up disease is more concerning to me because that's a lot harder to detect. That's why early testing for patients with especially chronic kidney disease and diabetes, it is a big deal. You need early testing because they may not present with your typical intermittent claudication. They might have numbness that may prevent them from feeling these leg cramps. A lot of times they'll start with, you'll hear neuropathy. I have just neuropathy. Well, where did you hear that you have neuropathy? Did you look that up on Google, or did you have an official diagnosis? And if you had an official diagnosis for neuropathy, did they talk about, did they even look at your blood vessels? Did they look at your circulation? Because the American Diabetes Association says that 85% of amputations related to diabetes are preventable. And one of the big ways in which it's preventable is if a doctor would only check the circulation, right? It might be the small capillaries that are causing the problem, but what if it's the main arteries? There's something that can be done to help. And so it's important that if you do have diabetes or chronic kidney disease, to get tested early before any symptoms occur, before you feel anything. And even if you don't feel anything, you really should get tested early, because that just presents differently. You end up with, if you wear a pair of shoes that are too tight, you might end up with a blister. Well, that blister starts just opening up and it's not healing, right? Then you have an infection. Then you end up with gangrene because it's not getting the oxygen and the other nutrients that it needs with blood flow. So that's the more concerning disease. That's a lot harder to diagnose. But if you hear that someone has diabetes, you hear that they have chronic kidney disease, you hear that they have an autoimmune condition like lupus, especially, you hear that maybe they have heart issues, it's really important that they get checked early and often for PAD, and making sure clear to their toes. They need to have a TBI, a toe brachial index. Make sure that they actually test the pressure in the toes. That is so important.
Wow, that's very informative. Thank you so much for sharing that. So often people brush off leg pain or just blame it on age or bad shoes. So what happens next? How do we actually treat the PAD?
There are a variety of different ways. It just depends on the presentation of disease. So many people just want a pill or a procedure to manually restore blood flow. But if we can catch it before it reaches, there are different stages of PAD. So you have, of course, the asymptomatic, you have the intermittent claudicant, where you walk, you get pain, you stop, you rest, the pain goes away, you walk again. Then you have lifestyle limiting claudication, where the pain's gotten so bad that you're barely able to do your job. You're not able to manage your kids or grandkids. You're not able to go to the supermarket and do your normal shopping in a reasonable amount of time because you keep having to stop. Then you progress to, which very few do, but we're seeing more and more progress to this stage because of lack of early testing, lack of early symptom mitigation, risk factor mitigation. They end up with rest pain or wounds that won't heal on their feet. And that we consider the most advanced stage. and that is critical limb ischemia or critical limb threatening ischemia. And then, of course, you always have the acute limb ischemia, and a lot of times that's more from people who are hypercoagulable and they have sudden blood clotting events, particularly in the arteries themselves for a variety of reasons, whether they're hypercoagulable due to like their heart or due to some sort of hereditary blood clotting disorder like factor V Leiden, factor 11, factor, there are all kinds of different ones, protein S, whatever it might be. Even an MTHFR mutation can also make you a little bit more hypercoagulable. But if you do catch it in the early stages, walking is the best medicine. Walking has level 1A evidence that if you walk and you walk regimented, so many people tell me, but I walk all the time and I get my 7 to 10,000 steps. Some even tell me that they get 20,000 steps a day. And why do I still have PAD? And isn't that counterintuitive that if I already walk all day, that I need to walk to improve my claudication? I don't understand. But it's the way in which you walk. You have to walk with purpose. You have to set aside a certain amount of time. It's not a matter of how many steps. It's great to move all day. You shouldn't be sedentary. The only thing that the steps measure is just simply that you are moving all day, which you should. But what you care about in order to manage PAD is the time that you set aside to treat your walking as a workout, where you can actually push through this claudication. You need to be telling your arteries, hey guys, we need detours. It's just like if there was a car accident or a big trash can that fell off the truck on the freeway and all the lanes are blocked because there's garbage everywhere. Well, what's going to happen? Everyone's going to get off on those side roads. What's different from a freeway is that when it comes to your body, you have this entire web of collateral vessels that when they're needed, when there's more demand, they start dilating. And I know doctors don't like the way I phrase this, but it paints the picture. They grow like tree roots in search of water. They grow like tree roots around these blockages, and they actually bring more blood flow. So as you are pushing through this claudication, you're saying to your body, hey guys, step it up. We need some more detours. Get the construction crews in here. Let's do this. And you're also, by the same token, teaching your muscles to do more with less. Your body is amazing. It's adaptable. And you can grow these collateral vessels and teach your body to do more with less. It's like if you go to the gym, right? And you're working with a trainer or you're working with a friend of yours, and you're doing 3 sets of 15 reps for bicep curls. And you're on your 3rd set, right? You with me now? You're on your 3rd set. You're on number 12. It's just starting to burn. And you're like, I feel like my arm is going to break off. I can't do it. And your trainer says, just give me one more rep, one more rep. It's the same thing. Just give me one more step. Just one more step. You'll feel the burn. It's going to take a little longer. When you stop for a second in that moment, you're going to feel pain get worse before it gets better. But over time, that's going to improve. And we hear it all the time. Walking is the best medicine. Now, that's the beginning. That coupled with medication, the PAD management guidelines talk about making sure you have blood thinners if you need them, making sure that you have statins if you need them. There's also a drug that can help. It's considered a vasodilator. It's cilostazol or Pletol. That might be an option for you. If you have other risk factors like diabetes, a good discussion to have is, will a semaglutide work for me? Something like Wegovy or Ozempic if you need to lose weight as well, because they just came out with a study called the STRIDE study, which showed improved walking distance in people with diabetes and peripheral artery disease in using those drugs. But of course, when you were talking about medications, you need to have a candid discussion with your doctor to find out what is right for you. On top of that, A1C, get that down. It's never down enough. Get it below 6. We hear from endocrinologists all the time that people rest on their laurels above 6. You can get it below 6. And that's really important. Get that A1C down, because even one sugar molecule can scratch your arteries, leading to damage and more plaque buildup. And
Yeah.
then on top of that, eating right and making sure you quit smoking. Those are the top ones. And those should be suffice. I mean, for most patients, there are other options available to manually restore blood flow, but that's a discussion at a later point with your doctor if those conservative measures don't work.
Got you. Thanks,
I love,
Kim.
sorry, I'm going to interrupt real quick. I love that you're actually physically walking right now while you are like pumping everybody up on the importance of walking, right? Even if it's at a stationary treadmill, like you're saying, right?
Yep.
Maybe you live in an area that it's like freezing cold and snow and bad weather, and people use that as an excuse to not move.
Yep.
So kudos to you being a good example and actually doing what you say right now.
It's hard. You have to get it in, and when you're working at a computer, especially all day, you have to get your steps in. I mean, I end up, I don't even know what I'm at 60 minutes already, and you forget that you're even on it after a while. But you can go on to Nextdoor, you can go on to Facebook Marketplace, and even if you can't afford one, I'm certain you can find someone with a walking pad or a treadmill or some sort of, even a stationary bike, just something that they'll be willing to give it to you for free or give it to you at a low cost. Some people just want to get rid of things because
Mhm,
they don't have room in their house, or maybe it's a moving sale.
mhm.
So there are always those opportunities to get them for you.
Well, Kim, thank you so much for sharing all of that. That gave us so much information, so much insight as to what PAD is and how we can maybe detect early risks, I'd say, with patients, and hopefully patients will be able to know how to identify if they have PAD themselves. But just quick, before we wrap up, how can we support the PAD Global Association and get involved?
So the Global PAD Association, it's great. Just go to padhelp.org. We also have multiple communities across the web. We have a walking community. We have a food community. We have a general community, which is the largest on Facebook right now. It's padsupportgroup.org. The walking support group is walkingsupportgroup.com. And we have a smoking cessation group. So people can join those, which is great because it helps us to have everyone in the community. And then sharing our hotline number, 1-833-PAD-LEGS would be really helpful because we work with great teams like yours. We work with teams across the globe to try and make sure that patients are able to get the best, most advanced, expedited care to prevent their PAD from progressing to limb-threatening levels.
Wow, that's amazing. Thank you so much, Kim. Well, thank you so much for being here with us, for the work that you're doing, and for sharing your passion with our team at Patient Pro Marketing. We are excited to help our patients bring back previous PAD patients and spread awareness to the community. Thank you again, Kim. Appreciate you for being here with us.
Thank you.
Thanks as always, Kim.